One of the most common questions that I receive when patients come in for a consultation is, Doc, will my implants fail? Can my implants fail? Do they last a lifetime? And I answer that question with the same answer for all my patients, which is the literature states that implants are 98% successful, which is a remarkable number. However, there are a variety of factors that can cause implants to fail. Number one would be, and probably one of the most important, is maintenance. The analogy I give to my patients is it's like a car. You buy yourself an expensive car, you never take it in for an oil change, rotate the tires, change the filters. That car after 5 years is going to start to fall apart, even though it was an expensive car when you bought it. It's the same thing with an implant. Your mouth, you're constantly using it, constantly chewing, constantly eating, and as a result of that, maintenance on the dental implant and the dental implant tooth that we placed on it has to be maintained properly. There are two ways to maintain an implant. Number one, at home, making sure you're brushing your teeth, making sure you're flossing, and then coming in consistently to the dental office to have that implant checked and cleaned on a consistent basis. The second reason why implants can fail is systemic health of a patient. Patients with uncontrolled diabetes, patients with osteoporosis and are currently on osteoporotic medications, patients who are undergoing, unfortunately, cancer treatments like radiation or chemotherapy. Those patients are not good candidates sometimes for implants, and as a result, they can have a higher incidence of implant failure. Smokers, patients who smoke, those patients have an increased percentage of implant failure and a lower chance of success. And lastly, sometimes this happens, especially in our generation of instant gratification, we try to rush the process for the patient. Everybody wants their teeth quicker than maybe what the body allows them to have it. So, for example, some patients need to heal a little bit longer than other patients, and we have to explain that to the patient and let them know that your body's still in that healing phase, and if you load that implant a little bit too early, that can go ahead and cause failure. So as a result, in Long Island Implant and Cosmetic Dentistry, the way to circumvent all those problems, number one, we take a very thorough medical history. We review that with the patient to make sure that they are a good candidate for a dental implant. We make sure that we go over oral hygiene instruction and set them up with consistent dental hygiene and checkup appointments. We explain to them how long their healing time has to be in order for having a successful implant. If you have any questions about your implant and dental needs, feel free to reach out to us at Long Island Implant and Cosmetic Dentistry. We're here for you.